The endocrine system meticulously regulates the adrenal cortex, thyroid gland, and gonads through the release of specific hormones, such as adrenocorticotropic hormone, or ACTH for the adrenal glands, and thyroid-stimulating hormone, known as TSH for the thyroid glands. This regulation significantly influences metabolic processes throughout the body. The interaction between the hypothalamus and the pituitary gland is characterized by the release of hormones that either stimulate or inhibit the production of other hormones. This intricate feedback mechanism is essential for maintaining homeostasis, ensuring that the body functions within its optimal ranges. A pivotal aspect of this regulatory system is negative feedback, where elevated hormone levels precipitate a decrease in the production of stimulating hormones. This mechanism is crucial as it prevents the overproduction of hormones, thereby maintaining a delicate balance within the endocrine system. In instances of excessive hormone production, such as the overproduction of glucocorticoids due to tumors, normal regulatory feedback mechanisms may become bypassed. This situation sheds light on the critical nature of tumor characteristics in the regulation of hormonal balance, emphasizing the complex interplay between pathology and endocrine function. Insulin production exemplifies substrate regulation as it is directly influenced by blood glucose levels. When blood glucose concentrations increase, insulin facilitates glucose uptake in various tissues, highlighting a classic feedback loop that is vital for energy regulation and metabolic homeostasis. The regulation of calcium and phosphate in the body involves the interplay of several hormones, most notably parathyroid hormone and calcitonin, which act in opposition to maintain a harmonious balance. Additionally, vitamin D is integral to calcium homeostasis, further emphasizing the complexity of endocrine regulation. Diabetes mellitus is a prominent endocrine disorder arising from either insulin deficiency or resistance. This condition serves as a compelling example of how imbalances in hormonal regulation can drastically affect metabolic pathways and overall health, posing significant challenges to those affected. Endocrine diseases can be categorized based on the number of glands impacted, leading to classifications such as monoglandular or polyglandular disorders. A thorough understanding of these classifications is paramount in aiding precise diagnosis and effective treatment strategies for endocrine conditions. Central regulatory mechanisms assume a pivotal role in the maintenance of endocrine health. Dysfunction within these central processes can lead to secondary or tertiary endocrine disorders, creating a cascade of hormonal imbalances that profoundly disrupt physiological equilibrium. Cushing syndrome is characterized by elevated levels of glucocorticoids, resulting in serious complications such as osteoporosis and immune deficiencies. These conditions enhance an individual's vulnerability to infections and stressors, underlining the profound effects of hormonal dysregulation. The central regulation of hormones, particularly ACTH, plays a crucial role in adrenal gland function. Any disruptions in this regulatory pathway may lead to conditions such as hypercortisolism or adrenal insufficiency, each presenting distinct challenges to endocrine stability. Insulin synthesis can be critically impaired due to damage inflicted on pancreatic beta cells, underscoring the delicate nature of hormonal balance within the endocrine system. This impairment is particularly consequential as it can lead directly to the development of diabetes. Zinc deficiency constitutes a significant factor leading to insufficient hormone synthesis, thereby playing a critical role in the development of conditions such as diabetes. Hormonal imbalances can also arise from various pathological processes that adversely affect the function of endocrine glands. Iodine deficiency is closely linked with the development of endemic goiter, a condition prominently characterized by thyroid dysfunctions. The functional capacity of the thyroid gland can vary, increasing or decreasing depending on the specific underlying pathological processes. Peripheral mechanisms associated with endocrine disorders, such as the phenomenon of insulin resistance in diabetes, underscore the importance of target cell sensitivity to hormonal signals. Such resistance can precipitate significant metabolic imbalances, complicating management strategies. Children experiencing thyroid hormone deficiency often exhibit abnormal skeletal proportions compared to typical growth trajectories. This distinction is critical, as it has profound implications for their physical development and long-term health outcomes. The exposure to excessive sex hormones during childhood can result in stunted growth due to the premature closure of growth plates. This hormonal imbalance underlines the necessity for vigilant monitoring during crucial periods of physical development. Gigantism arises from an excess of growth hormone during childhood, commonly due to the presence of tumors. This condition not only leads to pronounced physical alterations, but also poses significant health risks that must be managed carefully. Progesterone and estrogen serve as vital female hormones, influencing menstrual cycles and various physical characteristics. Additionally, they play significant roles in mental functions, fat metabolism, and reproductive health, reflecting their multifaceted impact on women's health. Androgens, including testosterone in men, profoundly influence male characteristics and reproductive health. Beyond these roles, they also affect blood clotting mechanisms and psychological states, illustrating their extensive effects on human physiology. Prolactin is integral to the lactation process and can lead to various syndromes when produced in excess. Moreover, it influences weight management in women during breastfeeding, showcasing its importance in both metabolic and reproductive health.